Let's talk about breakups. Not the kind where you divide up the record collection and argue over who gets the dog. I'm talking about a much messier, more damaging split. This is the story of your liver's bad breakup with its own health. A toxic relationship initiated by a relentless homewrecker called hepatitis. Imagine your liver, that hard-working, multitasking organ you probably never thank, suddenly finding itself in a dramatic, drawn-out divorce. It's a saga filled with inflammation, emotional distress, for you, and the very real threat of being left scarred and broken. This is beyond just a spat, a full-blown crisis that can last for years, sometimes a lifetime. This breakup doesn't start with a dramatic fight. It often begins silently, a ghost in your system. The hepatitis virus moves in, uninvited, and starts causing trouble. It's the ultimate gaslighter, making your liver question its own ability to function. Your liver, our body's unsung hero, processes everything you consume, detoxifies your blood, and produces essential proteins. It's the stoic, silent partner in your health. But when hepatitis enters the picture, it starts a relentless campaign of inflammation and damage, slowly chipping away at the liver's resilience until it can barely perform its basic duties. It's a slow, grueling separation that leaves one party devastated. The consequences of this breakup are severe. And we're not just talking about a few bad days. This split can lead to long-term scarring, a condition we call cirrhosis. Think of it as the emotional baggage that never goes away, making it impossible for the liver to move on and heal properly. In the worst-case scenarios, this toxic relationship ends in complete organ failure or liver cancer. It's the ultimate betrayal, turning a vital part of you against itself. This is not simply a metaphor. It's the biological reality for millions of people around the world who are living through this very personal health crisis every single day. Understanding hepatitis as a breakup saga helps us grasp its profound and personal impact. Beyond the theory of the clinical diagnosis or a set of symptoms on a chart, it's a narrative of breakdown and betrayal happening inside our own bodies. Throughout this video, we are going to unpack this drama. We will look at the different culprits, the types of hepatitis viruses, and explore how they orchestrate this devastating split. We'll examine the global scale of this problem, and most importantly, talk about how we can intervene, support our livers, and maybe, just maybe, push for a reconciliation with good health. So what is the core of this drama? What is hepatitis? In the simplest terms, hepatitis just means inflammation of the liver. The hepa part refers to the liver, and itis means inflammation. It's your liver's version of screaming for help. While toxins, alcohol, and certain medical conditions can cause this, the most infamous culprits are a family of viruses. These are the troublemakers we are focusing on today: hepatitis A, B, C, D, and E. Each one is like a different kind of bad partner, with its own unique way of causing chaos and heartbreak for your poor, unsuspecting liver. Think of these viruses as a gang of vandals, each with a preferred method of entry. Hepatitis A and E are typically the hit-and-run types. They get in through contaminated food or water, cause a short-term acute illness, and then are usually cleared by the body. They're like that terrible fling you had on vacation. Unpleasant, but you eventually move on. However, hepatitis B, C, and D are the ones that are in it for the long haul. These are the master manipulators. They are transmitted through bodily fluids like blood and can lead to a chronic, lifelong infection, relentlessly attacking the liver for decades. Why should you care about your liver's relationship status? Because your liver is the CEO of your body's internal factory. It performs over 500 vital functions. It basically filters toxins from your blood, helps digest your food, regulates your blood sugar, and creates proteins necessary for blood clotting. When hepatitis causes inflammation, it's like a workers' strike at this crucial factory. Production slows down, dangerous substances build up. The entire system of your body is thrown into jeopardy. Ignoring your liver's health is like ignoring the foundation of your house. Eventually, the whole structure is at risk of collapsing. The scary part is that this breakup often happens in secret. Chronic hepatitis, especially types B and C, is often called a silent epidemic because it can simmer for years, even decades, without causing any noticeable symptoms. A person can feel perfectly fine while the virus is slowly, methodically destroying their liver tissue. By the time symptoms like fatigue, jaundice, yellowing of the skin and eyes, or abdominal pain appear, significant and sometimes irreversible damage has already been done. It's a quiet, devastating betrayal that underscores the critical need for awareness and testing. We're looking at beyond just a local drama. It's indeed a global blockbuster of tragedy. The numbers are truly staggering and paint a grim picture of this silent epidemic. The World Health Organization estimates that over 350 million people worldwide are living with chronic hepatitis B or C. To put that into perspective, that's more than the entire population of the United States. Every single year, hepatitis leads to approximately 1.1 million deaths from complications like cirrhosis and liver cancer. This makes viral hepatitis one of the deadliest infectious diseases, on par with tuberculosis and surpassing the death toll from HIV/AIDS. Let's break this down by continent to see the true global footprint of this crisis. In Africa, chronic hepatitis B is a massive public health challenge, with an estimated 81 million people infected. In many regions, the virus is often transmitted from mother to child at birth, creating a cycle of infection that spans generations. Now let's travel to Asia, which bears a heavy burden. The Western Pacific and Southeast Asian regions account for nearly half of all global hepatitis deaths. China alone has millions living with chronic hepatitis B, a legacy of past infection waves before widespread vaccination became available. This isn't a distant problem, it is a clear and present danger across the globe. The story is different, but no less serious, in other parts of the world. In Eastern Europe and the Middle East, hepatitis C is a significant concern, often linked to unsafe medical practices and injection drug use. In places like Egypt, aggressive and successful public health campaigns have dramatically reduced hepatitis C rates, showing that progress is possible. In North America and Western Europe, while overall prevalence is lower, there are still millions affected. In the United States, for instance, an estimated 2.4 million people are living with chronic hepatitis C, many of them baby boomers who were unknowingly infected decades ago before screening of the blood supply became routine. The tragedy within these statistics is the silence. The vast majority of those 350 million people with chronic hepatitis do not know they are infected. They are the ghosts in this global machine of suffering. They are walking around living their lives while a virus silently wages war on their liver. This lack of awareness is the single biggest barrier to prevention and treatment. It means people aren't getting the care they need to manage their condition, and they may be unknowingly transmitting the virus to others. This silent suffering is why we cannot afford to look away. Not all liver breakups are created equal. Let's look at the different personalities of these viral homewreckers by comparing hepatitis A, B, and C. First up is hepatitis A. Think of this as the dramatic but short-lived affair. You get it from eating contaminated food or drinking tainted water, maybe from a food stall with questionable hygiene. The symptoms come on fast and furious: fever, nausea, fatigue, and jaundice. It feels awful, like a terrible flu, but the good news is that it almost always resolves on its own. Your body's immune system kicks the virus out, and you develop lifelong immunity. There's no chronic stage. It's a messy, but ultimately temporary split. Then we have hepatitis B, the complicated long-term entanglement. This one is transmitted through blood, semen, or other body fluids. A common scenario is transmission from an infected mother to her baby during childbirth. An adult might contract it through unprotected sex or sharing needles. For many adults, an acute infection can be fought off. But for infants and some adults, the virus never leaves. It becomes a chronic companion, a low-grade, simmering conflict that can last a lifetime. This is the partner that sticks around, quietly causing damage for decades, increasing the risk of liver failure and cancer down the road. It's a lifelong commitment you never signed up for. Finally, there's hepatitis C, the silent assassin. Like hepatitis B, it's spread through blood, with injection drug use being a primary driver of new infections today. The terrifying thing about hepatitis C is its stealth. Over 75% of people who get infected develop a chronic infection, and most will have no idea they have it for 15, 20, or even 30 years. It's the ultimate betrayal, as the virus slowly and silently destroys the liver from within. By the time someone feels sick, they may already have advanced cirrhosis or liver cancer. It's the breakup you never saw coming until your entire world had already fallen apart. To make this real, consider these brief cases. For hepatitis A, imagine a tourist, let's call her Jane, who gets sick after a trip abroad. She feels terrible for a few weeks, her skin turns yellow, but with rest and fluids, she makes a full recovery. For hepatitis B, think of David, born in a country with high prevalence. He contracted it at birth and is now in his late 40s to early 50s. He requires lifelong monitoring and antiviral medication to keep the virus suppressed and protect his liver. For hepatitis C, picture Maria, a woman in her 60s who had a blood transfusion before 1992. She's diagnosed during a routine screening and is shocked to learn she has advanced liver scarring, despite feeling fine her whole life. These stories show the diverse human face of this disease. When a liver breaks down, the fallout isn't contained to just one person. The impact creates ripples that spread through families, communities, and entire healthcare systems. On a personal level, a diagnosis of chronic hepatitis can be devastating. It brings fear of the unknown, anxiety about the future, and the stress of managing a lifelong condition. Patients often face stigma and discrimination, stemming from misconceptions about how the virus is transmitted. This can lead to social isolation, depression, and difficulty in personal relationships, adding emotional trauma to the physical burden of the disease. The financial toll is another massive ripple. Treating chronic hepatitis can be incredibly expensive. While new curative drugs for hepatitis C are a medical miracle, their high price tag can put them out of reach for many, both in developing nations and even for underinsured individuals in wealthy countries. For hepatitis B, treatment is often lifelong, involving regular doctor visits, blood tests, and costly antiviral medications. The indirect costs are also huge. People with advanced liver disease may be too sick to work, leading to a loss of income that can plunge a family into poverty. This financial strain is a heavy burden on top of an already difficult health journey. This personal and financial strain naturally expands to burden our healthcare systems. Hospitals and clinics must allocate significant resources to care for patients with hepatitis-related complications. Liver transplants, the last resort for end-stage liver failure, are extraordinarily complex and expensive procedures. And there are never enough donor organs to meet the demand. The cost of managing millions of patients with chronic liver disease puts a continuous strain on public health budgets, diverting funds that could be used for other critical health priorities. In essence, we all pay for the consequences of this widespread, yet preventable disease. Beyond the healthcare system, hepatitis impacts national productivity and economic development. A workforce weakened by chronic illness is less productive. Premature deaths from liver cancer or cirrhosis rob countries of their citizens in their most productive years. This is particularly true in low and middle-income countries where hepatitis prevalence is high and access to care is limited. The disease perpetuates a cycle of poverty and poor health, holding back entire communities. The heartbreak of one person's liver, when multiplied by millions, becomes a drag on the progress of nations. It's a stark reminder that public health and economic health are inextricably linked. To truly understand the damage, let's visualize what this breakup does to the liver. Imagine a healthy liver. It's a large, reddish-brown organ, smooth and firm. Think of it as a pristine, high-tech factory floor, perfectly organized and running at peak efficiency. Every part is clean, every pathway is clear, blood flows through it smoothly, getting filtered and detoxified without a hitch. This healthy liver is a beautiful, functional marvel of biological engineering, tirelessly working 24/7 to keep you alive and well. It's the picture of perfect health, the before photo in our tragic breakup story. Now let's introduce the hepatitis virus. When the virus begins its attack, the first thing that happens is inflammation. Picture that factory floor again. Now, imagine small fires breaking out all over the place. This is hepatitis. The liver tissue becomes swollen, tender, and damaged. Your body's immune system rushes to the scene to fight the fires, but in the case of chronic hepatitis, the fight never ends. This constant state of emergency, this ongoing battle, is what defines the disease. The liver is now a war zone, and its own defense mechanism is causing collateral damage in the fight against the invading virus. If this inflammation goes on for years, as it does with chronic hepatitis B and C, the liver starts to form scar tissue. This is called fibrosis. Think of the factory trying to patch up the fire damage with rough, shoddy materials. This scar tissue is stiff and disorganized. It can't perform the functions of healthy liver cells. As more and more scar tissue forms, it begins to choke the life out of the healthy parts of the liver. The smooth, efficient factory floor is now becoming a landscape of roadblocks and damaged equipment. Blood can't flow properly, and the liver's functions become progressively impaired. The final stage of this devastating breakup is cirrhosis. This is when the scar tissue has taken over so much of the liver that the organ becomes hard, shrunken, and lumpy. The factory is now mostly ruins. The liver can no longer do its job effectively. This leads to life-threatening complications: fluid buildup in the abdomen, bleeding from veins in the esophagus, and confusion as toxins build up in the brain. Cirrhosis is also the primary risk factor for developing liver cancer. This visual journey from a healthy organ to a scarred ruin is the stark reality of what happens when we let hepatitis win. Statistics and medical diagrams can only tell us so much. The true weight of this epidemic is found in the stories of the people living it. Let's talk about Kwame, a 35-year-old teacher from Ghana. He was diagnosed with chronic hepatitis B during a blood drive. He has no symptoms and feels healthy, but the diagnosis hangs over him like a cloud. He worries about the future, about whether he can afford the lifelong monitoring his doctor recommended. He fears telling his fiancée, worried she will misunderstand the disease and leave him. His story is the story of millions, the silent fear and the heavy emotional burden of a disease you can't see or feel. Now consider Elena, a 58-year-old grandmother from Romania. She contracted hepatitis C decades ago from a medical procedure with unsterilized equipment, a common story in her generation. For years, she battled extreme fatigue that doctors dismissed as aging or depression. Finally, a new doctor tested her for hepatitis. The diagnosis was a relief in some ways. It gave a name to her suffering, but it also revealed she had advanced cirrhosis. Her life is now a cycle of hospital visits and managing painful symptoms. She worries less about herself and more about being a burden to her children. Her story highlights the tragic consequences of delayed diagnosis. In the United States, we have the story of Robert, a 65-year-old Vietnam veteran. Like many of his peers, he was exposed to hepatitis C, possibly through battlefield medical care or youthful experimentation. He lived for 40 years with no idea he was sick. He built a career, raised a family. Then, a routine medical examination for his life insurance flagged a problem with his liver enzymes. The subsequent diagnosis of chronic hepatitis C was a complete shock. He was lucky. New antiviral drugs cured him in just 12 weeks. But his story is a powerful reminder that an entire generation remains at risk and needs to be tested. These stories are not just anecdotes. They are evidence of the profound human cost of this disease. They speak of fear, stigma, financial hardship, and the quiet suffering that statistics can never fully capture. They also speak of resilience. Kwame is now an advocate for hepatitis awareness in his community. Elena finds joy in the small moments with her grandchildren. Robert, now cured, volunteers to encourage other veterans to get tested. Their experiences underscore the urgency of our mission. We are not just fighting a virus. We are fighting for the lives, dignity, and futures of millions of people just like them. The good news in this breakup saga is that we are not helpless bystanders. We have the tools to fight back, to prevent new infections, and to care for those already living with the virus. Reconciliation with good health is possible. The first and most powerful tool in our arsenal is vaccination. Safe and effective vaccines exist for hepatitis A and B. The hepatitis B vaccine is a true marvel. It is the first vaccine proven to prevent cancer, specifically liver cancer caused by hepatitis B. Ensuring that all infants receive the birth dose of the hepatitis B vaccine is a cornerstone of global prevention efforts. For viruses where we don't have a vaccine, like hepatitis C, prevention focuses on breaking the chain of transmission. This means ensuring a safe blood supply through universal screening of all donated blood. It means promoting safe injection practices, not only in healthcare settings, but also through harm reduction programs for people who inject drugs, such as needle and syringe exchanges. It means promoting safe sex practices. It also involves simple but crucial public health measures, like ensuring access to clean drinking water and promoting good hygiene to prevent hepatitis A and E. These are practical, proven strategies that save lives. The third key to mending this broken relationship is testing and treatment. Because hepatitis is so often silent, we cannot wait for people to feel sick. We must proactively find the missing millions who are unaware of their infection. This requires making testing simple, affordable, and accessible. Once diagnosed, we must link people to care. For hepatitis B, there are effective antiviral medications that can suppress the virus, reduce liver damage, and prevent transmission. For hepatitis C, we now have revolutionary direct-acting antiviral drugs that can cure over 95% of cases in just 8 to 12 weeks, with minimal side effects. Finally, we must fight the stigma and discrimination that so often accompany a hepatitis diagnosis. This requires education and open conversation. We need to dismantle the myths and replace them with facts. People with hepatitis can live long, healthy, and productive lives. They can have healthy relationships and families. They are not defined by their diagnosis. Creating a supportive and understanding environment is just as important as providing medical treatment. It empowers people to seek testing and care without fear of judgment, which is essential for turning the tide against this global epidemic. We've walked through the drama, the heartbreak, and the devastation of the liver's breakup with health. We've seen how the hepatitis virus, in its various forms, can silently and relentlessly destroy our body's most resilient organ. We've looked at the staggering global numbers, the personal stories of suffering, and the societal costs that ripple out from every single infection. The scale of the problem is immense, but the narrative does not have to end in tragedy. We have the power to write a different ending to this story, an ending defined by healing, prevention, and victory. The path forward is clear. It is built on a foundation of political will, scientific innovation, and community action. We have the tools: vaccines that prevent infection and subsequently cancer, treatments that can cure hepatitis C and control hepatitis B, and public health strategies that can stop transmission in its tracks. What we need now is the collective resolve to use them. Governments must invest in national hepatitis programs. Healthcare providers must make testing and treatment a routine part of care. Communities must fight stigma and support those affected. This is a battle we can and must win. This is not someone else's problem. This is our collective problem. It affects our neighbors, our family members, our colleagues, and our friends. It affects the strength of our healthcare systems and the future of our global community. The silence surrounding hepatitis has been its greatest ally. But today, we can choose to be loud. We can choose to replace ignorance with knowledge, fear with compassion, and inaction with a determined and relentless push for change. We can be the generation that eliminates viral hepatitis as a public health threat. So I am calling you to action. Get informed. Know your own status. Ask your doctor about getting tested for hepatitis. Encourage your friends and family to do the same. Support policies and organizations that are working to expand access to vaccination, testing, and treatment. Let's end this toxic relationship for good. Let's give our livers and the millions of people living with this disease the happy ending they deserve. It's time to help the liver win the breakup. For more videos like this from Health Explorer channel, kindly like, subscribe, comment, and share this video. See you on the next one. Cheers!